Welcome to the McGill University Health Center. With the current COVID situation, the MUHC has put in place measures to ensure safe family presence. Before your visit with a loved one today, let's go over some infection control measures that will help you stay safe during your visit and beyond, while also ensuring the safety of other patients and staff. Note that visiting hours are from 9 a.m. to 7 p.m. Most patients are currently allowed a maximum of 2 designated family members or caregivers throughout their hospitalization. If you have been designated by your loved one, you may visit if you are visiting a patient on your own. Patients can have only one visitor at a time unless specified otherwise by your loved one's care team. You are the only visitor that day. While Montreal is in a red zone, only one person can visit each day. Designated family members or caregivers must alternate the days in which they visit the patient. You do not have any symptoms of a respiratory infection or been exposed to someone with symptoms or someone with a respiratory infection. You have not traveled outside of Canada in the last 14 days. We will ask you to 1. Wash your hands often. Hand washing is important in preventing the spread of COVID-19. Today, we'll ask you to wash your hands every time you enter and exit the hospital, and whenever you go in or out of your loved one's room. Unless specified by a care team member, gloves should not be worn. 2. Keep a safe distance from others. We ask that you stay at least 2 meters away from other people at all possible times. To help give you an idea of what 2 meters looks like, think of the height of a door. 3. Wear a mask. You should always wear a mask when you're in the hospital. You may wear your own mask or one provided to you at the hospital entrance. Be sure that the mask covers your nose and mouth. Once you've got it on properly, do not touch your mask nor your face. If you happen to touch it, make sure to wash your hands after. When it comes time to removing your mask, make sure to take it off by the straps behind your ears. 4. Limit where you go while in the hospital. We kindly ask that you stay in your loved one's room as much as possible. If you need help for things such as getting extra blankets, or ice, or water, please let us know by using the call bell in the room. You may leave the room for essential reasons, such as buying food. To limit circulation in the hospital, and because family rooms are currently closed, we encourage you to bring your own food. Please note that microwaves and fridges on the units cannot be used and that family rooms are currently closed. In order to limit circulation, we prefer that you visit only once a day if possible. 5. Minimize the amount of objects you bring in. Wearing clean clothes and avoiding to wear jewelry are some ways to reduce the spread of germs. We encourage you to also disinfect your cell phone whenever you enter and exit the hospital. 6. Stay safe in between visits. What you do outside the hospital matters just as much as what you do when you're here. In addition to the healthy habits we went over today, make sure that in your personal life, you respect the public health directives related to gatherings, and that you stay away from people who exhibit symptoms of sickness. Some units may have specific directives, such as more restricted hours, or may need to have further restrictions temporarily. We appreciate your patience and collaboration as the guidelines may change over time as the COVID-19 situation evolves. On each visit, you will be asked to sign a log and to declare that you do not have COVID-19 symptoms, or been exposed to someone with COVID-19, or have traveled outside of Canada. Everyone is asked to comply with these infection control measures, and we thank you for respecting them during your visit. This allows us to welcome family members at the bedside while ensuring everyone's safety. We thank you in advance for your cooperation and for being there for your loved one. We wish you all the best as you spend time with them today. If you have any questions, don't hesitate to ask the care team. Now let's go over some steps for properly washing your hands.
Apply enough hand rub hydroalcoholic solution in the palm of your hand. Rub your hands together in order to cover all surfaces of hands and fingers. Continue rubbing all surfaces of the hands, including nails, thumbs, and fingers, until completely dry.